It's Dr. Farmer, and welcome to this week's unit in Psychopathology of the Elderly. This week we will cover assessment of psychiatric disorders in older adults. Again, this week's reading is a PDF that can be found in the content section of D2L. This chapter covers the assessment techniques that are used to assess the elderly. Some key things to focus on during your reading are: what are the components of multidimensional assessment, such as physical health, adaptive functioning, and social functioning. Also pay close attention to the multi-method assessment approach. This includes self-reports, reports by others, and then direct observation. Also, this chapter covers the assessment process, the steps that you go through to complete an assessment on an older adult, so make sure you understand that. And then it also gives you some strategies for assessing older adults. As you know, the older adult population is a unique population, and we need to have an understanding of what things we need to do to have an effective or perform an effective assessment of older adults. And finally, this week's discussion questions ask you to consider an assessment that you personally experienced and how it made you feel. As a clinical psychologist, I think it's very important for us to understand the people who we are working with. And one of the best ways to do that is to remember times when we were in the places that they had been. The second question asks you which assessment technique you think is most effective. There's no right or wrong answer to this question. I'm just interested in understanding how you view assessment and what you think is most important when assessing an individual. I'm looking forward to reading your responses this week. Let's get started.